A growing number of dental professionals are questioning the safety of a commonly used material in dentistry, amalgam. It contains mercury and is considered by many to be a health risk. In some countries, amalgam has even been banned or severely limited in its use. However, the Canadian Dental Association says it's safe. But reporter Gar Lewis says some Huntsville dentists and their colleagues don't happen to share that view.
For about a dozen years now, Huntsville dentist Dr. Jim Jenkinson hasn't used amalgam in his practice. He's firmly convinced the mercury content can cause a number of health problems for his patients. Jenkinson says he can't understand why Canadian dental associations are defending its use when a number of international scientific research studies confirm there is a potential health risk.
I would like the Health and Welfare Canada or whoever is in charge of determining these types of materials to look at them all, look at the whole variety of materials that are used, implanted in people's mouths in the dental profession, and determine that these have a level of safety, that all of them have been tested, and that there's an understanding that they are safe for long-term use in the body. That just hasn't happened before. Too many of these materials have been around for so long that no one remembers when we got started using them.
The Canadian Dental Association, however, and the Ministry of National Health and Welfare say there's little evidence that the health of the vast majority of people with amalgam fillings is at risk. Dr. Terry Hicks, the Director of Dental Services for Muskoka and Simcoe County, agrees with their research to date.
Based on the scientific evidence that we have now, they should not be concerned about the mercury fillings. We have to separate conjecture from science. And conjecture would say there may be a problem, and science says, having looked at this scientifically, we don't see a problem.
But nobody can convince York Regional Police Officer Monica Lees that amalgam hasn't been the cause of her health problems. She was diagnosed with chronic fatigue syndrome 2 years ago, and when her doctor told her about a possible link to her amalgam fillings, she decided to have them all removed.
So they started a regimen of taking out the fillings, and the first two that they took out, I got violently ill. I came home, I was very shaky, very pale. I started throwing up, started having all other problems that were related to my illness, and then after a few days it subsided. And then again, when they took a couple more out, I got sick again. And on top of that, I decided, well, I'm going to start doing research. So I went down to the medical library in Toronto, took a whole bunch of other books and started reading, and I firmly believe that mercury poisoning from my fillings has attributed to my disease or even has caused it.
Once the amalgam is removed from the teeth, there's still a certain amount of mercury left in the body. This must be flushed out before the patient can completely recover from its effects. Homeopath Dr. Deborah Gollage does this by treating the patient with various vitamins and assorted minerals.
We also, I believe we're the only clinic in North America that are doing it in this depth, is that we use homeopathy, or I use homeopathy, to specifically prescribe for the patient's symptomatology. So therefore they're getting a remedy or a group of remedies that are specific for them, which help their healing, and also the nutritional detoxification program, which I put them on. And then when they come in to see me, I'm testing them for biocompatibility of all the materials, so that whatever the dentists choose to use, whether it's the resins or the anesthetics, the etching gels, all the different components of dentistry are tested on that patient, so that nothing that is being replaced into the tooth is going to be toxic to them or cause another problem.
When we talk about replacing mercury fillings, we're replacing them with something else. And that something else is a material that's relatively new in dentistry. It's a plastic type of material called composites. It's only been in use maybe generally widespread for the last 10 or 15 years. This material is not as good a material as amalgam in terms of chewing and wear, so that this material wears much faster, has to be replaced more often, and we don't have any long-term safety data on this material. So here we are replacing a known material with a relatively unknown material with no safety record, and a material that's not as good a restorative material, and a material that wears down faster. So if there is something in the composites that we maybe shouldn't be exposed to, it's going to be entered into our system much faster than the mercury amalgam fillings are. So I have a concern about the replacements, because the only replacement for mercury that's a superior restoration and has no safety problems would be gold.
Well, we've been using them exclusively for the last 13 years and for some time before that, and in our experience they've stood up very well. It's certainly a more conservative material, doesn't require as much tooth structure to be removed, and it's a more aesthetic material, and there aren't as many questions about its toxicity. Yes, there are some concerns, and this material needs to be tested as well, but nothing on the scale of the amalgam mercury issue.
The Health Protection Branch of Health Canada is currently conducting a risk assessment study of mercury in fillings and will be issuing a report by the end of this month. Jim Jenkinson says he's glad to see the federal government is now taking a serious look into this important issue.
Well, I'm rather pleased, actually, because it's the first time that a federal agency, particularly in the health department, has actually looked at this issue with any degree of seriousness. In the past, they've relied on information provided to them by other sources, and this time they're actually doing the study themselves and reviewing the literature, and I suspect they'll find what we have, that there's just not much out there to demonstrate their safety.
Jenkinson says a number of international manufacturers have either sold their amalgam divisions or have decided to stop producing it altogether. They feel between the declining usage and the risk of lawsuits that it's not worth the risk and have moved on to producing composite and other materials. So while a growing number of dental professionals continue to lobby the Canadian government to have amalgam banned in Canada, and dental associations continue to defend its use, what about the people who already have mercury fillings, or those who have cavities yet to be filled?
Well, my feeling is the biggest thing that should come out of the current reports or research is at the very least informed consent. People should be made aware of the risks surrounding mercury, of what its possible effects are, that the effects are not necessarily right away, they can be 20 years down the road, and be allowed to read information and make a choice of what they would rather have placed in their heads for years and years and years, and in the heads of their children.
In Huntsville, Ontario, Gar Lewis for Sunday AM.
You know, today's